Medical Monday. Dr. David Mathias is here with Aurora Bay Care, and we're talking about an interesting topic, but something that needs to be discussed, right?
Absolutely.
Okay, so after heart disease, when is it okay to resume in sexual activity?
Let's first talk about heart disease.
Yes.
Because there's various types
Sure,
of heart
okay.
disease. And the most common, and that's what we'll primarily talk about, is patients who have had a heart attack or a stent or bypass surgery who need to resume normal activity. And it takes time. It takes a little bit of time. But the idea is for them to get better. The idea is them to get back to normal activities. And as I tell my patients, the idea is if we do our job and you do your job, you should be better than you were when all this started, not limited.
Absolutely.
And sexuality and sex is part of that. And nobody, it's interesting. A lot of people don't ask because they're afraid to ask the doctor. And a lot of doctors don't talk about it.
You told me a lot of doctors don't.
No, because they're uncomfortable with it.
So patients should be bringing this up too. If their doctor doesn't address it, patients should be asking.
Absolutely.
What role do spouses play in this? This is interesting to me. What role should they play?
Well, one, they should be advocates.
Okay.
And two, they're involved because if your husband or your wife has a heart attack, you're afraid.
Yes.
You're afraid that you're going to hurt them. The cliche of people dying in bed, which is a big cliche, and in reality it doesn't happen very often.
Oh, it doesn't, okay, because you see that in TVs and movies and things like that. That's not real.
No. Interestingly enough, most episodes of heart attacks that are induced by arguments.
Really?
More so by far than any sexual activity. But you don't stop arguing with your spouse.
I was getting ready to say you don't stop arguing.
No.
So these are topics that must be discussed. So I guess on your road to recovery, the real important takeaway here is to have an open conversation with your doctor about everything that's going on.
Yes, and rehab. Because the big part of rehab is you get exercise, you physically feel better, you're exercising, I can do the treadmill, I can do that. And as part of that comes back we could resume sexual activity. Normal sexual activity, it's okay. I'm in better shape, I'm not having anything happen. And that's really where conversations with us and where cardiac rehab really helps.
That's really important. Like you said, not limited, you want to be better.
You want to be better. And if, again, a year after you have a heart attack, the idea is, and I have many patients who come back and go, I'm in the best shape I've been in 10 years. And the other thing I'll let you know is that patients who have regular sexual activity have a 50% lower risk of dying.
There you go.
So it's
another reason, right?
So for normal activity, it's good.
There you go. Normal reasons to every day do it. All right, thanks so much, Doc. For more information and things you should be discussing with your doctor, visit our website and click on this story. We'll be right back with more Wisconsin Tonight.